Well, I was obviously diagnosed with prostate cancer, and I went around to see some urologists and get their opinions and get their input. And actually, I started out with Dr. D. Consini here, and was scheduled to do have open surgery with him. I had already decided that I was going to elect the surgery route. And so scheduled the open surgery. I was supposed to go in and donate blood or give blood for the eventual surgery. And then he suggested that I talk to Dr. Michel because he was qualified to do the robotically assisted laparoscopic surgery. So I saw Dr. Michel and I elected to do that. And in the course of all that, I was reading up on the subject. I did a lot of reading, did a lot of research on the internet, so that by the time I got to the surgery room, I knew that this is exactly what I wanted to do. And I also visited with oncologists, a radiation oncologist and a medical oncologist to explore other treatment possibilities, and decided that the surgery was the right way for me. That was the right thing for me. I also had an uncle who had prostate cancer, and he had done the surgery. Actually, it was an emergency surgery. And then his son, my cousin, had prostate cancer about 3 months before me, and he elected to have surgery, though it was the open surgery. And so I went through the surgery, and because I had read up on it, I kind of knew exactly what to expect, and it came off just the way they said it would. And of course, what you want to hear coming out of surgery is, "We got it all," and that's what I heard from Dr. Michel. So it was a successful surgery. I had also talked to other doctors about the same procedure, entertaining the notion of using a different surgeon, and surprisingly, I was quite shocked to hear another surgeon saying some things that I had read were not true. And I don't know if it was a sales pitch or if it's possible to get a bad match with a surgeon, but it actually confirmed my choice that I was making the right choice, going with Dr. Michel to have the robotically assisted laparoscopic surgery. And of course, after the surgery, everything returned to normal within a couple of months at the outside. I had overcome the incontinence from the surgery, and erectile function was back, and the day after they took the Foley catheter out. I was sure that I made the right choice, and particularly in terms of honesty. After talking to other surgeons and reading up on the subject and educating myself about all of the options that are available to me. Oh yeah, I have total faith in the whole office staff here. They've been very pleasant to deal with, and no surprises there. Yeah.